Hey, this is Doug Field, along with my co-host Brent Macy, and welcome back to this segment of Healthcare Consumerism Radio. And joining us to talk about where we are with transparency and how it's evolving and maturing is Robin Gelburd, President of Fair Health, one of our regular sponsors. Robin, good to have you on the program.
Thank you so much.
Yeah, tell our audience a little bit about Fair Health, and let's talk about where we're going with this in this space.
Sure. Fair Health is a national independent nonprofit organization with a mission to bring transparency to healthcare costs and health insurance information. We do that by offering comprehensive data products, really rich consumer resources, and we support health services research. We have a database of billions of medical and dental claims from over 150 million people across the country that we use to support those products, those consumer engagement tools, and health systems research.
Great. You talk about why transparency is no longer enough. Would you expand upon that, Robin?
No, absolutely. We distinguish at Fair Health between transparency and clarity because transparency, while very well-intentioned and really the beginning of the process to start releasing information to consumers and other stakeholders, doesn't really go far enough. Mm-hmm. And one way to think about it is almost to think visually of a sink of dishes, if you will, that could be piled high, dirty dishes, glassware and silverware and so forth. It's transparent to your eye, but you really can't make sense of that chaotic pile. If you take those same elements, the dishes, the glasses, the silverware, and array them on a beautifully set table, that's now starting to make or tell a coherent story of those same elements. And that's what we try to do with our data and hope others do as well, which is really to take the data, make it transparent, then move it down the line to clarity by providing context and information surrounding the data so you can really inform sound decision making.
Now, is definition of clarity helping that consumer, really understand, quality, accessibility, and price, all three of those working together?
The way I view it is that clarity really means taking data and making it actionable. Mm-hmm. So yes, to your point, it is helping to advance decision making, whether it's just about helping to evaluate cost and comparing in-network versus out-of-network or one provider venue versus another. And as you sort of move along, I think what we're starting to see, the demands for transparency increasing beyond just price, but going to quality features, going to sort of practice features as well. For example, I think there's a real appetite on the part of consumers for information as to whether a provider accepts email scheduling, does it offer an electronic health record, even down to the basics, is there parking or how long do I have to wait for an appointment? Some of the aspects of service that you would see in other parts of, various markets.
Now, Robin, this is Brent. When you look out at the transparency space, and it's been exploding for over the past 5 to 7 years. When you look at all these tools out there, are all the transparency tools created equal, or are there different pieces to your solution versus what somebody else might have?
Now, that's an excellent question. We don't view all those tools as equal. Mm-hmm. The intent may be the same. As I said, they all may be very well-intentioned to try to advance the conversation of transparency, but in practice they're not equal. First of all, you have to think about what's fueling those transparency tools. Mm-hmm. You may have a really creative interface on a web-based solution, but what's really powering that interface in terms of the data itself? Is the data robust? Does it reflect the geographic specificity that would be meaningful to a consumer? Is it from an independent source? Is it refreshed continually? Mm-hmm. Is it subject to algorithms and methodologies in aggregating the data that are statistically defensible? So there are all kinds of questions to ask. It's no different, if you will, than going into a supermarket and looking at the nutritional packaging for a particular cereal or other product. You want to know what's going into that product. The same thing with any transparency tool. You really want to ask questions about how is this being fueled? Are the ingredients pure? Mm-hmm. If you will.
Now, Robin, you alluded to it a little bit earlier on the segment, but elaborate a little more on how some of these transparency tools can help educate and empower the consumer to become that better educated consumer of health and healthcare?
No, excellent question. So there have been surveys out that have shown when you've polled adults, a majority of adults do not even know the meaning of copay, premium, and deductible. We're talking about very basic terms that are integral to any benefit plan. Mm-hmm. So there's really an enormous amount of healthcare illiteracy out in the public that really needs to be addressed. So to really bring and move a consumer from transparency to clarity, you have to start with the vocabulary of insurance, with fundamentals. What's really of great assistance to consumers is if you really package that data with educational material that explains what is a high deductible health plan, what is the difference between a PPO and an HMO, what are mental health parity laws, how do I understand anesthesia reimbursement and how that's being calculated, all those kinds of basic principles that allow a consumer to really take that data. We almost view it as sort of driver's ed and allow them to get on that highway, if you will, and really drive carefully and in a way that is meaningful, to an ultimate destination.
Now, Robin, your organization, Fair Health, is going to be a sponsor of our IHC events, and specifically our private exchange forum in Dallas. Where, when you're looking at the private exchanges, what's your fit there? Where do you see that market moving when it comes to transparency along the private exchange market?
Sure. So the private exchange, and the emergence of private exchange as well as the public exchange is a big part of why there's so much wind at the back of these consumer transparency tools and why they're so needed. Because you're basically putting consumers in the middle of a virtual marketplace and asking them to go shopping. Mm-hmm. And in order to not have that consumer blindfolded while they're shopping and to make a good choice, they need information. And the way in which Fair Health data can support the exchanges, and private exchanges in particular, is helping consumers really evaluate the components of a plan to see if it's right for them. One thing data is finding is that consumers are sometimes blinded just by the premium amount, and they're not looking at the other elements of cost sharing, like copay, coinsurance, and deductible, as well as what the out-of-network reimbursement design is. Because we have data, and billions of claims in geographic regions relevant to a consumer shopping on the exchange, our data can easily be plugged into tools offered by plans offered on the exchange to show apple-to-apple comparisons. So, for example, if you are interested in Plan A and maybe interested in going out-of-network for a particular procedure, maybe a knee replacement, you would be able to juxtapose what the in-network fee of that exchange would be with the out-of-network. And that out-of-network component should be grounded on the market heartbeat of that particular area, and that was where Fair Health data comes in. Right now, Fair Health data is populating a number of plan tools that allow consumers to really appreciate what their out-of-pocket exposure will be, particularly if they go out-of-network.
Yeah, I completely agree with you. I think when we look at the private exchange space, and it's very much to the segment that you have titled here, is with the emergence of private exchanges and the amount of people that are going to enroll in those, transparency really isn't going to be enough to satisfy that segment of the market, much less the big broader market of those who won't maybe necessarily go into an exchange, correct?
Correct. No, they really need really concrete examples. The other way in which Fair Health data is very helpful is if you know you have a chronic condition, type 2 diabetes, for example, asthma, hypertension, or you know that you're in store for a particular procedure in the coming year, whether it's a knee replacement, a hip replacement, or expecting a child, we can create three-dimensional views of the data so that we can link together and create episodes that allow you to have a fuller picture of what your exposure will be, and you can look at what the reimbursement would be under, Plan A versus Plan B versus Plan C, and do very concrete comparisons. And people are really starting to demand that information. And we know on our website, we really try to prompt consumers to understand that three-dimensional nature of care, because sometimes, for example, if they're looking for a colonoscopy, they'll look at the gastroenterologist fee, but we have tools on our website that will prompt them to say, if you're looking for that, you should be interested in the pathology in case there's a polyp and it needs to be evaluated, and you need the anesthesiologist fee as well. So it's a really, it's really important that the consumer is primed and educated about broadening their view as to what their exposure may be.
Robin, in the last minute that we have here on the program, in your opinion, where do you see, the challenges and opportunities over the next, let's say, 2 to 3 years?
Yeah, well, it's such an exciting time right now. It really is like a living laboratory that we're all in real time to see these tools evolve and enter the marketplace, and we really applaud that kind of energy. I think the challenges will be, definitionally, are we creating a common vocabulary that's allowing consumers to really understand and compare choices and options? New York just passed a law recently, very groundbreaking. The New York Times has suggested that this could become a model for the entire country. And what it does is create a standard definition of usual and customary cost. In fact, Fair Health Data, our 80th percentile, was designated as that independent source of data. And what that allows now is requirements for disclosure of plans and providers to articulate how they're charging or how they're reimbursing in connection to this UCC standard, and it also becomes a standard by which to resolve disputes. So now everyone can sort of rally around a common definition and articulate what kinds of reimbursement or coverage will be as compared to a set standard. So I think we'll see a lot of legislative action. They may not mimic New York completely, but a number of state legislatures are starting to take up the issue about emergency care, surprise balance bills, out-of-network services, recognizing consumers in this very consumer-centric market need support, need equitable solutions, need some protections, and most of all need information.
Robin, well, we thank you very much for joining us on the program. Quickly, let our audience know how they can find you.
Yes, they can come to fairhealth.org, which is our main organizational site, and if they want our cost transparency tools, that would be fairhealthconsumer.org.
All right, Robin, thank you so much for joining us on the program and your support of the Institute for Healthcare Consumerism. I hope you have a great weekend. And to the rest of our audience, we will talk to you next Friday, or are we off next Friday? So the following Friday, everybody have a great Thanksgiving.